So we're going to go over the pressure regulated volume control, or PRVC. So this one is really probably the most common one that you guys are going to see. So this one for sure you really need to know for your test. So let's just talk about some aspects to this. So let's go up here to the what. So what is it? It's a form of assist control ventilation. The breaths for it are both ventilator and patient breaths. So it's controlled breaths and it's spontaneous breaths. When it's giving breaths, it's a constant pressure during the inspiratory time. It's a pressure the whole time. So if we go over here to look at the settings, some different settings that you'll have to have for the PRVC mode. So you'll have to set a tidal volume. You'll have to set a rate, to set PEEP, FiO2, to set an upper pressure limit, a rise time, and your I to E time. So if we go over here at, let's go look at the method, right? The method of how this works. How does PRVC work? So what happens is the ventilator adjusts the pressure with each breath as the patient's compliance and airway pressure changes. Airway resistance changes, I'm sorry. So just what that means is the ventilator is constantly calculating the compliance and the airway resistance, and it's adjusting the pressure from breath to breath that it gives. So when we're talking about the breaths, the pressure that the ventilator will give, it's going to deliver a max pressure that's the one that you set 5 below your upper PIP alarm. So if you set your PIP alarm at 30, it's not going to deliver a pressure greater than 25. So let's go over here. So the PRVC mode, it uses the backup rate that you set when the patient's spontaneous breath is below that. So this is a really good mode to use because it can be completely spontaneous for the most part, or it can be more assist control as the patient needs it. So if you have a rate set of 16 and the patient is doing 10 breaths, the ventilator is going to make that up. So let's go over here to why. Why would you use this? This is the mode you guys are going to see the most often. So you would use this because it's really good because it reduces lung injury, right? Because it's constantly adjusting the pressures. Over here, since it is a constant pressure, you do not want to use it with your COPD or your asthma patients, and that's just because they already have a high pressure in their airways by themselves, so you don't need to add any more constant pressure to add to that. So those patients you don't want to use PRVC for. Up here, so PRVC is good for oxygenation since it does deliver that constant pressure. So if you're having patients that are having some problems with oxygenation, you might want to try this mode if you're not already in it. And then over here, just some other names for this mode and different ventilators is Volume Ventilation Plus, Adaptive Support Ventilation, and Auto Flow. So that is it with PRVC.